For many people, a normal day can change in an instant. A smile disappears, speech becomes slurred, and some side of the body suddenly refuses to move. Every year, thousands of Ugandans experience this life-changing condition known as stroke. While many survive, countless others are left with permanent disabilities that affect not only their lives but also lives of those families. Yet experts say many of these outcomes can be prevented through early recognition and timely treatment. A stroke occurs when blood supply to the part of the brain is interrupted or when a blood vessel in the brain bursts. Without oxygen, brain cells begin to die within minutes. Doctors explain that there are two major types of stroke: ischemic stroke, caused by a blocked blood vessel, and hemorrhagic stroke, caused by bleeding in the brain. Both are medical emergencies requiring immediate treatment, as Dr. Joel Kiriabwire, head of neurosurgical unit at Mulago National Hospital, explains.
There's one where, for one reason or the other, the blood vessel gets blocked. And we'll explain what we mean by that. And because of that, that whole area which is supposed to get blood does not. And that area does not function well, and in the long run, will get a stroke. The second one is where a blood vessel bursts. And this could be for a number of reasons. But when it bursts, that area still does not get blood. And when it doesn't get blood, it also doesn't function well, and the patient is said to have a stroke. So in both cases, the brain area does not get enough supply of blood, and because of that, it cannot function. Blood is what makes the brain function. If there's no blood, it doesn't function, and therefore the patient presents with signs of stroke.
Health experts attribute the growing burden of stroke to the increasing prevalence of non-communicable diseases and unhealthy lifestyles. What could be the cause of stroke?
I'll start off with the one where the blood vessel bursts, because that's the more common one. And in that one, the commonest cause of a blood vessel bursting is your blood pressure. In Uganda, the number of people who have high blood pressure is increasing every year. Some of it is because of just blood pressure alone, but many of our patients have diabetes associated with the blood pressure challenge as well. And the perceptions we have, the way we look at blood pressure, is such that we feel that the best way to treat it is outside the use of regular medicine. Most of our patients who get tired of swallowing medicine because of various reasons are the ones where the blood pressure shoots up, and when it does, it bursts a blood vessel and you end up with a stroke. The second type of stroke is the one where the blood vessel gets blocked. And this blockage usually occurs because there is a clot which comes from somewhere else in the body and blocks a small blood vessel in the brain. The blood vessels in the brain are very small. So you can have a clot coming from the bigger ones, and when it tries to enter the one of the brain, it just clogs it all completely. And there is no blood which can flow. And that's when you get a stroke. And it's the blood clots nowadays are very common. I don't think there's anybody now who doesn't know somebody who has had a challenge with blood clots. And one of the things we are going to discuss later is how do we look after ourselves so that we don't get this kind of blood clots. So you can see that stroke has got a very varied possible cause. And because of that, we need to look out for ourselves, because if you don't look after your life in your day-to-day, you're going to be a candidate.
Although stroke is often associated with old age, specialists warn that young adults are increasingly being affected. But what does the patient with stroke present with?
There is an increasing number of patients coming into the hospital who have suffered stroke. And the days when we used to believe that stroke was a disease for those who are older is changing, because the number of patients we're seeing who are relatively young is increasing each and every passing year. If you look over the last 5 years, stroke has been the 5th commonest cause of death within Uganda. Now that is comparing it with other, disease processes like HIV, malaria, TB, and it's the fifth largest. So you can imagine how many people we are losing every single day to stroke. And every single day, we have an admission of about 5 patients coming into Mulabo alone.
Recognizing warning signs can mean the difference between life and death. Other warning signs include sudden severe headache, loss of vision, dizziness, and difficulty in walking. Health experts encourage the public to remember the word FAST. F stands for facial drooping. A means arm weakness. S represents speech difficulty, while T reminds everyone that it is time to rush the patient to the nearest health facility.
But for stroke, because the brain is not getting blood, if you don't respond quickly, you're going to find that area of the brain will be permanently affected. And when that happens, you cannot revive the brain at all. So before you do anything, look out for a possibility of taking that patient to a health center or to a nearby clinic to be able to be evaluated. The evaluation is best done by the doctor, and it is best done quickly.
Diagnosis begins with brain imaging, usually a CT scan, to determine the type of stroke before treatment is started. Depending on the diagnosis, doctors may administer clot-busting medication, perform surgery, or provide supportive care. Specialists emphasize that patients who arrive at the hospital within the first few hours have the greatest chance of recovery. For survivors, recovery often continues long after discharge from the hospital. Physiotherapy helps restore movement. Speech therapy improves communication, while occupational therapy enables patients to regain independence. Rehabilitation can take months or even years, demanding commitment from both patients and caregivers. Despite progress in stroke care, challenges remain.
One of the things that we as a country need to do is to build capacity because we definitely do not have the level of health personnel to be able to look after people who have had a significant stroke. So the call is to improving on our training, making accessible training for people to be able to go into this area of neurology and neurosurgery to be able to make a difference to the stroke patients in the time frame that makes a difference. One of the things about it is that you are supposed to be able to get to the doctor in a certain time and be treated during that time. If you delay because there's no personnel, then you have a challenge. So yes, we need to train more to be able to look after our patients better.
Stroke can happen to anyone, anywhere, and at any time, but it does not have to be a death sentence. By recognizing the warning signs early, seeking immediate medical attention, and embracing healthier lifestyles, more lives can be saved and more families spare the devastating effects of this condition. Zahra Abigaba, UBC